one way to help increase thoracic mobility in the spine is by using a foam roller and rolling on it through your thoracic spine. So to set yourself up, you just want to position the foam roller just below your rib cage, and then you want to elevate your pelvis and butt off the ground, and then you want to roll using your legs all the way up to the base of the neck or top of the shoulder blades there, and then roll back down. And this is something you can do for 30 seconds or a minute to help increase the thoracic mobility in your spine. Your lat muscle is an important muscle in shoulder function, and it's a muscle that also can be tight and is sometimes overlooked when it comes to working out trigger points and flexibility in the shoulder. So the way you can actually utilize a foam roller to help work out the trigger points in that lat muscle is you want to position this right at about the lower portion of your armpit. You're slightly angled on your side, because that lat muscle runs from the back all the way behind the back of the shoulder. So once again, you have to raise your pelvis up a little bit and use your legs to roll up to the back of the shoulder and then back down to right about the midpoint of the rib cage. It takes a little balance, and you may have to rotate forward or backwards a little bit to actually get that muscle. But trust me, when you find that trigger point, you'll know, because it will be tender if you have one, and you just continually work that area. The pec muscle is another muscle that's important in shoulder function. You know, I really don't think there is not a muscle that's not important in shoulder function, but it's another one that you can isolate and can have trigger points in and can be associated with shoulder pain. So the way you use a foam roller to address those is you want to put the foam roller right on the side of your pec, and you're going to roll from the side of your pec into the armpit and then backwards and forward. Once again, if you have any knots or trigger points, it will be tender. Women, you may have to be aware that you have to push your breast tissue out of the way to actually get deeper into the pec, more so than a guy would. The posterior muscles of the rotator cuff can be a hard area to get and address yourself. So I want to show you a few ways that you can try to address those with the actual ball and another device called a Theracane. So if you have a ball, and keep in mind that this can be done on the floor or against the wall, because sometimes if your shoulder is very tender and painful, it may hurt to lay on the floor against it. We're going to start with showing you one on the floor. But we're talking about these muscles on the back side of the shoulder here, and you position yourself so that ball is right on those muscles. Once again, if you're tight and tender, and I do have some knots there, just want to roll backwards and forward on those muscles. You also can, we talked about internal rotation and external rotation of the shoulder. You can actively move the shoulder through those ranges of motion while applying pressure with the ball in this position. And the same thing can be done while you're standing up, utilizing the ball against the wall. The trapezius muscle is another muscle that most people are familiar with as it relates to the shoulder, and a common area people get trigger points and knots in. And what you can utilize, or I like utilizing, is a Theracane, because you can actually put pressure right on that trigger point or knot in the trapezius muscle, and you can actively stretch your head in multiple directions, or you can just massage that trigger point with the actual Theracane, and you can put down as much pressure as you like or as little pressure as you like.